The Obama administration said today it is revising its healthcare website to allow changes like a new family member or the death of someone who was enrolled. Some families say the Affordable Care Act is limiting their doctor and hospital choices. Here's Carter Evans now with a case in point.
What began as an ear infection for 4-year-old Kate Fink soon became much more serious. Her mother, Sarah.
She couldn't hear really at all in one ear, so that was really scary.
Kate's eardrum had ruptured. Her doctor recommended a specialist at Seattle Children's Hospital.
You have all the what if it's permanent, what if it's, untreatable.
The care was authorized by Sarah's insurer through Washington State's healthcare exchange.
This is an approval letter for the coverage.
Yes.
4 days later, this is a denial.
Exactly.
That letter says the hospital is out of network.
Is this an isolated incident?
This is not an isolated incident.
Dr. Sandy Meltzer is with Seattle Children's Hospital.
The exclusion of a major provider like Seattle Children's from a major insurance network in this market is unprecedented.
The hospital is considered in-network on only 2 of the 7 plans from Washington State's Health Exchange. It's now suing to be included on all of them.
We're seeing denials of care, disruptions in care. We're seeing a great deal of confusion and at times anger and frustration on the part of these families who bought insurance thinking that their children were going to be covered, and they've in fact found that it's a false promise.
The Affordable Care Act is supposed to provide a wider choice of doctors and lower premiums, but the insurance industry says it is simply too expensive to do both. That's reflected in a new study by an insurance industry consulting firm. It found the number of in-network providers is shrinking nationwide. 70% of insurers on state health exchanges are offering narrower or ultra-narrow hospital networks.
That's why we all pay into the system, is because in that moment when you're in a dire situation, then you hope that the insurance company is going to take care of you.
And what'd you find out?
That it kind of backfired.
For now, Seattle Children's Hospital is picking up the tab for Kate and more than 200 other patients facing the same dilemma. But eventually, their parents may have to pay the bill. Carter Evans, CBS News, Seattle.